Good morning. Hi, my name is Andrea and I am Sammy's nurse today. So if it's okay with you, I just have a couple of things to do this morning. I need to get some vitals and do just a quick assessment. I have some questions for you if that's okay.
Perfect, yeah.
All right. So I see, how was Sammy's night last night?
He woke up a couple times just to eat and stuff,
Okay.
but he went right back to sleep, so it was kind of nice.
All right. When did Sammy eat last?
Around maybe an hour and a half ago, around 6 o'clock.
Okay, perfect. And how much did Sammy eat?
Well, he nursed.
Okay.
So I think he did about maybe 8 minutes on mom's one side and then maybe 6 on the other.
Okay, so I'll make a note of the time that he breastfed. And then have you or mom changed any diapers this morning?
Yeah, before she went to rest, so probably about 30 minutes ago.
Okay.
And I think she put it over at the sink for you.
Perfect. I'll go take a look in case we, need to see anything. Was it pee or poop?
I think it was both.
Okay, wonderful. Excellent. So, like I said, I have a couple things to do. Now, you said mom is resting.
Yes.
So, what does that make you?
I'm Grandma.
Grandma.
Yes.
It's nice to
And
meet
he's
you.
my first grandchild.
Oh, so wonderful that you're here with him and taking care. So, I'm going to get some equipment, but if it's all right with you, I'm going to do as much of my assessment and my vitals with you guys just like you are right now. So if it's okay, I'll work around you and let Sammy, he's content and comfortable. Sounds like he's had a nice breakfast. So I'll do as much as I can with you here in the chair. If that's all right. Okay, so what I'm going to do is go and get my stethoscope because right now Sammy is very quiet. He's content. He's with the person he loves. He's being well soothed. So I'm going to go with that. So I would come over and I'm going to start. So Grandma, I'm going to start just taking a quick listen to Sammy while I can. All right, and if you don't mind, I'm just going to reach in. Hi, sweetheart. I know. Shh, 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 shh. And I'm going to listen here. All right, so now I'm doing heart rate. We are listening for an apical pulse for 1 full minute. Okay, so we're going to do a full minute. And then once I have that, I'm going to go, okay, heart rate. Now I'm going to listen for the respiratory rate. And while I'm listening to that respiratory rate, again for a full minute, I'm listening to the quality of the breath sounds. So I'm moving around as much as I can. All right. Now this can be kind of tricky with small infants. It's going to be very fast. Their respiratory rate and their heart rate. They're like little hummingbirds, okay? So some tricks and things you can do that often help students kind of count because it is quick is you can close your eyes, right? So you can focus on counting if that helps you. Sometimes I will put my hand here, or if I can look and see, I can watch the chest rise and fall. So I can look, listen, feel, whatever I can do without upsetting Sammy. I do that to help me get the respiratory and the heart rate. All right, and so Sammy is still content. So I'm gonna take this out, all right. I'm gonna listen to his tummy since he had that big breakfast this morning. Let's see how everything's going on here. So I'm listening to my 4 quadrants. Sounds like we're working on breakfast. That's great. And I take a quick feel, right? So as I'm doing this, I'm also observing Sammy. I'm looking at him, at his respiratory rate, looking at his work of breathing. That's something we're going to talk about in respiratory lab that's really important because children are excellent compensators. Their compensatory mechanisms work fantastically and exactly like they're supposed to, which means these little guys will work very hard if something's going on to compensate for it. So they will maintain great oxygen saturation. They'll maintain, vital signs that are close to within defined limits. But it's taking a lot of energy for them to do that. And the problem is children are great compensators, but they don't have reserve like adults do. So once they've kind of expended all of that energy, they're done. Okay, so we want to look for subtle changes and we want to look for how hard they're working to maintain those great vital signs. So I've listened, I've looked, I've done heart rate, I've done respiratory rate, I've listened to the quality of the heart sounds, I've listened to the quality of the lung sounds, I've listened to bowel sounds, I've watched him. I don't see any signs that he's working hard to breathe. It's nice and easy, he's relaxed, so I can continue on with some more of my assessment. Now, I've also asked some questions that tell me about GIGU. I asked to get a nice pee and a poop. So Grandma, when you changed him this morning, any diaper rash or anything looking red or bumpy?
No, everything looked great. But there was that, the umbilical cord, they called it.
Oh yes, so that's their, and it should be drying up. It'll fall off on its own. So we just kind of keep an eye on that. If it starts to look red or you notice any discharge or anything from it, let us know. But if it looks like it's kind of just shriveling up and drying, that's great. You can, sometimes you fold the diaper down a little bit just to keep it from rubbing on that.
Because that clamp is still on it.
Yeah, so otherwise, we'll just work around that, and you let us know if it concerns you at all.
Okay.
Okay? And also, as I've reached in, I felt Sammy's skin with my hands. I can feel quality of pulses. Lots of the pieces of my assessment I can do visually, and anything I have a question about, I'm going to utilize my expert here. As a pediatric nurse, remember, we're the experts in pediatric nursing, but our caregivers are the experts in this child. So we want to use them as the experts. All right, so now if you're okay, he's still kind of quiet. I'm just going to grab a quick temperature, and then I may take him over, if you're okay, to the bassinet to do a couple quick other things, but then I'll give him right back to you. Okay. I know your time is important with him, so I'll give him back. All right, so now that I've gotten a lot of those things done, like I told Grandma, the next thing I might do is grab a quick temperature. So like I showed you in the last video, I think I'm out of probes, but I would insert this to get my probe on, adjust to the pediatric axillary. And hi, darling, I know I'm gonna try it in here. And with doing an infant assessment, I'm gonna pull the clothes out of the way to get right in the center of that armpit, and then I'm gonna hold it in here. Shh, shh, shh. Now they may start to wiggle and fuss. They really don't like this. I know, sweetheart, okay. And then it's gonna beep. I'm gonna take it out and write down my reading so I can remember that. All right, now these last two things, Grandma, are probably going to, they may make him a little bit more fussy, especially the blood pressure, but that's okay, so I'm gonna do that last. All right, I just need to get down here and get a quick little look at these feet, because you've had him wrapped up and nice and warm. I'm sure these feet are nice and cozy. Yes, they are. I know, sweetheart. So I'm going to come in like I showed you, and this is no longer very sticky, but I'm going to wrap that around the foot. Make sure it's positioned well. Use the sticky. Here we go. And then I can take that cover and just kind of cover that back up. Shh, shh, shh. I know. And now I'm looking at my monitor for a good waveform. Once I get it and I obtain my reading, great, okay, all right, we'll flip that right off. Done with that. The last thing, Grandma, is the blood pressure cuff. You know what this is like, same thing it does to you when you go to the doctor's office. So you might, if he starts to wiggle around, just, passy, whatever you need to do, we'll keep him nice and calm. You're doing such a great job, Sammy. So I would attach this to his lower extremity. Now, my plastic baby here is a little bit more difficult to maneuver than a real baby, but I would attach that, wrap it around, and then I'd be like, okay, I'm gonna go hit the button, Grandma, so if you'll just keep him nice and swaddled, and then get the best reading that I can. Okay, wonderful. Now, if Sammy starts to get upset, right, I might say, okay, well, Grandma, if it's all right, I know he's getting a little fussy. I'm almost done, so if I can just grab him real quick, I will walk through the rest of my assessment very quickly. Hi, darling. Okay. So I'm gonna bring him over to, if I'm working with the bassinet, so I can come in here and I can use that pacifier or whatever else that I'm using to help keep Sammy nice and quiet. I know, sweetheart. Right, so I can use that pacifier. And now, thinking about thermoregulation, I do need to take a good look at Sammy. Skin is really important. It tells us a lot, so I want to make sure I have good lighting, and then I can take a quick look. I'm feeling, right? So this is my very young newborn, so I'm feeling skin, but I'm also taking a look at fontanelles. There's a lot that I'm going to assess there, but that I can do with just a nice soothing touch. Yes, I know. And then I'm taking a quick look at the belly, and I'm watching again for breathing, and I'm gonna keep him warm. And Grandma said she didn't see any signs of rash, but if we're here and the baby is in need of a diaper change, we're gonna go ahead and offer to do that because I can assess quite a few things here with that diaper change. So I would take off the diaper, and I would take a look at the genitalia. I would look for signs of diaper rash. I would look at the bowel movement or the urine to see what that looks like, do a quick change, and then get him all cleaned and wrapped back up. Now with our young infants, right, remember what's one thing that when you're handing off a young new baby to someone is we want to protect their head, right, because they don't have any strength in their neck yet. So we expect that they have head lag. That's developmentally appropriate. So one of the things in our young infant assessment that we're going to do is, now he's not going to have head lag because he is a plastic doll, but should I gently pick this baby up, you would anticipate that his head would lag backwards, and that's developmentally appropriate. So carefully and safely, we would pick them up, look at the head lag, and then we don't drop the baby, but we're going to kind of let go like this with our patient in a safe position, so that when we go like this, we would notice their reflexes, that startle reflex. So we're kind of looking at those things, right? And then we're taking a look. I'm watching him move and moving the extremities around a little bit. So all these pieces of my assessment that I need to do, musculoskeletal, skin, temperature, I'm feeling for pulses, right? And so that's telling me about cardiovascular beyond just listening to the heart rate. So I'll finish up with my assessment pieces. I'm gonna make sure Sammy is swaddled back up. So let's talk about a swaddle. You're going to need to know this semester for both this course and for your maternal infant. So if you've never swaddled before, what you're going to do is take your baby blanket, and we want it to be in a diamond, okay? So corner at the top, I'm gonna make a little triangle. So I have wings and I have a little triangle, and that triangle is where my infant's head is going to go. So supporting my infant, I'm gonna lay them down in that triangle, and you wanna think about making them as secure and tight, like a little burrito, a little baby burrito. So the first thing I'm gonna do is I'm gonna kind of keep those little busy arms that like to grab NG tubes or other pieces of equipment, and I'm gonna keep them kind of down by their side, and I'm gonna reach over and I'm gonna tuck this blanket under. So I may roll Sammy a little bit and kind of tuck that nice and snug. Not super tight, but we're gonna be snug. Remember, they've been snug for 9 months, right? So we're gonna keep them nice and snug. I'm gonna bring up the tail of my blanket here, and depending on how long that is, I can give it a quick tuck. And then I'm gonna take this other arm here, and I'm gonna bring it across, and I'm maintaining, you know, nice and snug, and I'm watching those little arms, and I might roll Sammy again and place the blanket there. Voila, I have a nice little baby burrito. All right, so that's a swaddle. We'll practice that during your boot camp as well. But now that I've done most of my assessment, I'm gonna bring Sammy back over to where he was comfortable when I walked in the room. All right, he's all yours again, Grandma. Sammy's doing fantastic. We'll be back in an hour or so just to see if you need anything. If you need me before, my number's up here. You just give us a call, okay?
Thank you.
You're welcome. And that's how you're gonna walk through your approach and assessment of a young infant.